Good morning, good afternoon, good evening, ladies and gentlemen, wherever you are in the world. Welcome back to the Caring Economy with me, your host, Toby Usnik. Today, I'm really happy to be joined by Joan Steinberg. She's president of the Morgan Stanley Foundation, and she's CEO of the Morgan Stanley Alliance for Children's Mental Health, which we're going to delve into today. The alliance was established in 2020 to address the sadly escalating crisis in children's mental health and has already benefited over 37 million youth, families, and educators globally. Joan is the leading voice on how the pandemic and social inequity have impacted youth mental health. And with no further ado, I want to say welcome to the Caring Economy, Joan.
Thank you so much for having me.
We usually ask our guests to give us a 3 or 4 minute synopsis of their life journey, how they got where they got, maybe mentors or pivots along the way, because we all know nobody got where they got by themselves.
I think, like so many of your listeners, part of this is by accident, always. I started out with an English and comms double major, so got into public relations, obviously. And then I was too young when I became a junior account executive to really have paying clients. So they gave me all their pro bono work and I was hooked and I never went back. So I parlayed that into a little bit of a nonprofit career and then was able to transition to here, Morgan Stanley, and I've been here for 27 years.
And what have your roles been in your tenure there?
All a year. I never really left the same department, but it's just more, I've gotten more senior as I've gotten here, but I was always in community affairs.
Tell us about what you're doing there. You've got a couple of hats that you wear at Morgan Stanley, and maybe give us an overview of the two that I described in the intro.
On the sort of company side, I'm our champion of giving back, which is a core value of the firm, and we encourage and support employees to be engaged in their own communities. And through our work with the Morgan Stanley Foundation and our sister international foundation, I also direct our grant making. And in particular for this conversation, I lead the Alliance for Children's Mental Health, which is really around, as you mentioned, this sort of escalating crisis that we're seeing within young people. And are there things that we can do to sort of stop that?
Yeah. So can you, it is sad, the rise. Can you sort of level set for our listeners as to maybe some of the trends and the reasons that Morgan Stanley and you chose to go into this space?
Yeah, so I think it's important to note that we were actually a corporate funder of children's health programs for probably 60 years, back to kind of when our foundation was started. But in 2018-ish, it was a little bit of a good time on Wall Street, and we were able to get a little extra cash. And we really had a dialogue around what should our next steps be. And it became evident to us very quickly that mental health was a huge part of sort of children's health overall. In fact, at the time, it was the second leading cause of death in children over 10. And yet it's not an area that we had paid attention to. And the more we dug into it, the more we saw how critically underfunded it was. And I want to be careful. This is pre-2020, because I feel like there's sort of this false narrative that COVID somehow caused a mental health crisis. And it's important to note it exacerbated an existing crisis. Mm-hmm. So some of the statistics, like 1 in 5 kids will have a mental health disorder, and that, as much as 2/3 of the kids won't receive care for the symptoms they're already showing. I mean, those things unfortunately haven't changed. It's just more and more and more. So that's really how we got started. And it really became, what can one company do, and how can we possibly get others to join us?
Is it a fair assumption to say pre-2020 that social media also plays into all of this for young people, young minds?
It does. And I want to be careful. It's not a be all end all. It's not all bad. It's not all good. Social media created connections for lots of kids who may have been isolated. Think about the LGBTQ community. It gave voices and opportunities for connection to many kids, but it also comes with bad, particularly with problematic internet usage, addiction to things, the gaming addictions, obviously some of the body dysmorphia issues that we see, particularly in young girls. But it's contributing. Again, I don't want to act like it's the only thing that happened. It's not, mental health is not a new phenomenon. And the fact that young people have been caught up in it is also not new. This is just things that are exacerbating what already exists.
Yeah. And fortunately, people are now at least having conversations where in the past, I think shame and secrecy or embarrassment kept a lot of these conversations from happening. So the awareness level, the education was lacking. So I'm glad that we do have more people like yourself talking about it. I wonder, though, I gave some stats at the start of this. I wonder if you have any sort of main talking points you use about the stats that are sort of most either notable, shocking, or actionable.
Yeah, a couple of things I would note. First of all, this is about kids. There are adult mental health issues, and I'm not abandoning them in this, but half of all adult mental health problems start before the age of 14 and 75 before the age of 24. So working on approaches to kids really is also about solving problems for adults. So I think that's a important note. I think the other important note is that this is prevalent when you look at anxiety and depressive disorders. You're talking about some 20% of society is going to have these. So this is something we're all dealing with, all of our families. But as I mentioned before, the real crisis comes in the fact that the majority of young people who are exhibiting symptoms aren't getting care. And when you look at it from a charitable perspective, only 1.3% of all philanthropy goes to mental health causes. So you have a problem that's affecting vast majorities of people. You've got an issue where there's not appropriate care or help-seeking behaviors happening. And then you have a philanthropic sector not helping to sort of fix those statistics. And that's really where, for us, we felt like we had a great opportunity and a role to play.
Yeah. Are there particular organizations or individuals that you work with or collaborate with in your efforts?
Yeah, we actually have members that are part of our alliance, hence the name Alliance,
Yep.
and they experts who actually serve on an advisory board for us to make sure that it's expert opinions that are weighing in and helping us think about our direction. They include the JED Foundation, Child Mind Institute, in London, Place to Be. So there's a number of partners, including two new ones, which hopefully we can talk about because we're very excited about it. When we set out, we really tried to look for people, again, because of the underfunded situation, we tried to find organizations that had effective and proven models and figure out how to turbocharge them through grant making, right? Get them to scale. And we looked at sort of two audiences when we started, sort of school settings, particularly high school and college, and parents themselves as good go-betweens to try to reach young people. But we're really excited because we've added sort of two new audiences as we think about it. The first are preschoolers and how to get at preschool programs and parents really, really early on in early education, particularly about giving those kids some tools and language so that it's not until they're teenagers that they're sort of first dealing with it, that they were given tools really, really early. And our partner is none other than Sesame Street Workshop, which is, of course, the expert in, yeah. So we cannot tell you my excitement level about sort of Elmo being my buddy now, but there's nobody better at what they do. And as you may be aware, they already work with an extensive network of preschool providers and are able to work across Head Starts around the country to really get at the most vulnerable kids with these kinds of programs. So very excited about that. And then the second partner are actually pediatricians. And through the American Academy of Pediatrics, we're partnering on doctor training to better prepare pediatricians to be able to meet the needs of their patients. And in our case, particularly underwriting those physicians who work in underserved areas. So we really feel that those are two additional places to really catch kids, catch them early, and provide some services before things have become chronic or you're really starting to see negative outcomes.
And I presume with the pediatric group, that's going to be domestic US because it's an American association. And is
That's
Sesame
domestic.
Street global as they are, or is it US focused for now?
We have global partners, but we traditionally do them by country. So we have partners in the UK, we've got a partner in Hong Kong, and we think about it on a local delivery because there are nuances, whether it's the NHS or the fact that pediatricians in Europe may not follow kids as late as 18. It really depends on the culture of the country.
Okay. And when you made the decision to sort of double down on the alliance, given all that's going on, was it a leadership decision? Was it a CEO decision? Was it a employee survey kind of a response that got you that to double down, or how did that
Well,
decision?
a little bit of all of it. I think that, to be fair, it was a no-brainer. I don't think we ever had a discussion where somebody pushed back. So we obviously, the board of the foundation had to approve it for the grants, but we also spoke to senior leadership here at the firm. And I think employees were voting with their feet. The attendance of employees at our learning sessions, their engagement with the material has been outstanding. So I think there was a lot of broad-based support for us to continue. And then I would say, in all honesty, it's not like we solved the problem in 5 years. I mean, that would be ridiculous to say anyway, considering even one company, even giving $50 million is not going to fix this. But I think that we just really felt that hitting 37 million people in 5 years was amazing. And the amount of work still left to do is a lot. And it's a challenge, and we're up to it.
Yeah, truly amazing. Kudos to you and your colleagues. Does employee volunteerism at Morgan Stanley have any active participation in sort of treatment's not the word, but getting your employees to work with these alliances or out with students and young people?
Yeah, so I want to be careful that in some of the cases, what our partners do involves sort of clinical care. And there's no part of Morgan Stanley where we're encouraging employees to suddenly start providing therapy to
Oh, yeah.
anyone.
Yeah, yeah.
So that's not, it's not sort of traditional volunteering. I think we've approached it slightly different. Number one, obviously educating them where they can be advocates, for example, advocating for things in their own schools and their own towns that are good for kids. But in a lot of ways, engagement has been around users. About 40% of our employees are parents. And there's been a huge interest in the materials that we're sussing out through our research, through our partnerships, where they're really interested in those outcomes. So to your point, we did a session on problematic internet usage and got a couple thousand employees to tune in to hear about what they could do for their own families and what they could do to take care of their own children. So I think there's been a lot of interest in that, and we keep exploring other opportunities for employees to engage. We haven't yet figured out the Sesame Street angle, but they're going to go nuts.
They sure are. And I mean, they have done so much great work around the world and everything from refugees to um,
Truly.
autism. I mean, it's really quite astonishing. Ladies and gentlemen, again today on the Caring Economy, we have as our guest Joan Steinberg. She's president of the Morgan Stanley Foundation. She's also CEO of the Morgan Stanley Alliance for Children's Mental Health, which we were discussing today. Joan, I wonder if you have any kind of insights you could share about mental health globally and where, and like I would think that Ukraine and certain parts of the world where we're in, or Israel, Hamas, the numbers are up. But can you give us any kind of color globally about the state of mental health for young people?
Yeah, I unfortunately the things we're sort of seeing here in the States, some of the examples I've previously given you, they carry over pretty much everywhere. It's the great leveler in that anyone could struggle with mental health. I mean, you mentioned some traumatic experiences, and we certainly know that trauma can lead to additional mental health problems, PTSD, and others. And there's a whole body of work around trauma-informed care that I don't want to act like an expert on, but on how to kind of think about that. And you've mentioned, Sesame Street and others working with refugee populations.
Mhm.
So I think that we certainly want to look at those kinds of areas, but just human beings generally are sort of dealing with this. And I think if there's one good thing that came about because of COVID, and I really do mean one, it's that everyone got to kind of witness and see what's happening with mental health in a way that hadn't been previously. It can be very helpful because once it's normalized, that everyone has moments of anxiety, everyone has moments of depression. It doesn't mean a clinical diagnosis, but we can all recognize those feelings and hopefully have a little bit more empathy for people who are struggling. You mentioned stigma before. I think it's important to note we just partnered with the Jed Foundation, who did a pretty important study on stigma in teens. I
Mhm.
think it's the first major one since COVID. And they kind of found what you talked about, which is the old version of this where you're embarrassed or you feel shame about maybe having an issue. That's not really what's going on, but there are still things that are stopping young people from seeking help. And we need to figure out kind of what's the new stigma, what is kind of preventing it. It was very interesting. I'm a parent of a teen. The most important thing that I took out of that study is, who kids actually want to go to when they're really struggling? They still want to go to their parents. So I can tell you as the parent of a teen, you don't feel like the most important person in your kid's life anymore, but you still are. But then interestingly, what they said was their parents weren't always the best when they did go to them. We're Mr. Fix It. We're trying to fix things. We're trying to always solve problems. And maybe that's not what they need. They needed a
Yeah.
really good listener who would do it without judgment.
Yeah. And also mental health is such a broad catchment of many different things. I worked for many years with Glenn Close on her Bring Change to Mind organization, and that's where I really learned how important the stigma piece is
Yeah.
and really just hurting people. But also the variety of issues that are, PTSD and schizophrenia and bipolar, and it's not all one easy thing to solve. It's so
It,
complex.
it isn't, and I think you're well aware, but there's also a dearth of trained professionals in the space, particularly pediatric trained specialists. to be able to handle the sort of cases that there are. And so we are experiencing really a crisis in sort of emergency rooms and bed availability,
Mhm.
kind of on the worst side. But even for people with milder symptoms, it can be difficult to access care.
Yeah. Do you know, in terms of not necessarily your competitors, but in terms of the corporate sector, are there other brands besides Morgan Stanley that are really engaging with this that we should?
There's a little bit of a growing group, but I would say we're not big enough to make the dent we'd like to. Again, if only, less than 2% of giving is going there,
Mhm.
you can see that. So I'm happy to say that more brands are getting into it. I would strongly say, though, for any corporation that's focused on kids, just as an example, I would really urge people to look at where mental health is weighing into the factor you're dealing with. So, people who are looking at education and looking at dropout rates, there's no doubt that the mental health crisis is affecting those dropout rates, that young people who are struggling are less likely to be in school. They're less likely to stay in school. So, that's factoring in. For people who look at the criminal justice system, something like 70% of kids in juvenile delinquency programs have mental health disorders.
Mhm.
So, chicken or the egg, which came first? But you really have to look at, is it untreated mental health care getting treated as criminalization that may be causing some of this, and is early treatment a way of preventing longer term issues?
Yeah,
So those are just some examples.
yeah, and of course, I'm sure. I mean, I've heard things. I can't cite a stat right now, but the equity issue is a real compounder as well, right? You're going to see
Absolutely.
the most diverse population probably being even more more exposed, excuse me, to the
Well,
bad
there's a
effects.
number of factors. There's certainly cultural differences that may be playing into things like stigma. Certainly in underserved populations, the physical barriers to getting care can be higher. You have the financing system of it, you have transportation issues, all the things that typically go into care issues. But I would also note that rural populations, regardless of sort of ethnic background, are also some places where it's a real crisis because there aren't enough medical providers within reach. And you
Yep.
see some pretty scary suicide rates compared to the average in rural places. So there's just a lot of factors that go into this.
I was at an equity conference yesterday with U.S. News and World Report in Washington, D.C., and there was a panel of all women about talking about maternal health care. And a concept they use, and it sounds relevant here, is healthcare deserts. It's the
Yes.
same thing. We've heard food deserts in the past, and so I think we're seeing that also come to bear. I wonder. I know you have something. I think it's called the Innovation Awards
Yeah.
program. Tell us a little bit about that.
Yeah. So when we looked at things that we could fund in the space, there were a ton of really innovative ideas and sort of startup charities looking at how they could help young people in their communities. And so obviously we decided to go sort of huge with our initial set of grants, but recognizing there was a whole world out there we weren't going to be able to fund. We started the Awards with the idea that we could give a small cash piece, there are $100,000 grants, but more importantly, use our voice to kind of really highlight what's happening, and try to get other funders to come in. And that's really what the Innovation Awards started as. We've had 2,200 applicants, so we've definitely tapped into something. There are a lot of organizations in this space trying to be helpful. And then after a couple of years, we realized it's amazing. We've got 5 winners each year, incredible organizations doing incredible work. But kind of what about the other 2,000 organizations? So this year we also added a leadership learning series, which is really about capacity building for the sector. And
Uh-huh.
we invited some of the smallest organizations that had applied to please join us. And we're partnering with the Bridgespan group to provide a multi-lesson series really on capacity building, strategy planning, leadership, to try to help these organizations think about their own scaling strategies and to try to get their ideas beyond sort of whether it's one site or one program or one group of kids, and really expand, because we think that the more people in this sector, the better overall. And so if
Mhm.
we can do anything to sort of strengthen the whole sector, that's what we're shooting for.
That's fantastic. I wonder if someone listening wants to find out more, where do you direct them?
They can go to morganstanley.com/giving back. And if
Mm.
you go into our Alliance section, you can see all of our application information. And we actually do a webinar for any nonprofits who are thinking about applying to tell you what we're actually looking for so that you don't waste your
Great.
time.
Yeah.
But it's really about uniqueness. we're really looking for organizations that are testing out new ways of reaching young people. So if you think you have an innovative idea, we're happy to hear about it.
And is the Innovation Awards right now just domestic, or do you use it in other regions?
Right now, it's just domestic because coming out of the U.S. Foundation, we will. This is hush hush secret, isn't released yet, but we are adding an innovation award program in Europe that'll concentrate across children's health and well-being. It won't just be for mental health, but you'll have to stay tuned because we're not announcing that yet.
Yeah, you'll have to come back. And then I know it's Morgan Stanley is your employer and the founder of this, but do you take in, if philanthropists want to get involved, or do you take in money as well to put toward the alliance, or is that?
We don't usually take it in, but we will partner with organizations that are already doing this and help steer them, connect them to our partners, look at if there's co-funding opportunities. So we're happy to work with anybody, and particularly would encourage folks who are thinking about this to look at our Innovation Awards winners. There's a ton of information on our website about them, but we're obviously thinking they've got an interesting idea. We're willing to put our money behind it. So we'd love to see other people come in and join us.
Is there one or are there two that you might want to share, just the highlights that kind of illustrate what it would
Yeah,
be?
I mean, I'll certainly share one that's like one of our first year ones, just because we had talked about the rural. It's the Rural Behavioral Health Institute. And when we met them, they're out of Montana. When we met them, they were, I think, a year old and had less than $100,000 budget. But they were started by a social worker and a teacher who were looking at what was happening with their young people. The model was just so simple, which is test every kid in a high school, and then for kids test through known means, proven methods,
Mhm.
and then identifying kids who sort of showed up as having maybe some issues and get them immediate help. And it was really about short circuiting that whole system of kind of waiting forever and trying to figure out when to get in. And it just took one high school, one health partner, and this sort of free test. So we
Wow.
thought that was a really interesting and low cost way of doing it. I'm so proud to say that multi-millions of dollars later, they're now expanded. They're in multiple rural areas, and they're starting to get sort of government support because it's a really good model for rural kids, and it was really effective. You were taking kids showing any sign of worry and immediately getting them connected to people who could help them. So that's just a sort of
I love
early
it.
example. And then
Yeah.
one we have this year that I really like is Give Us the Floor. This is just an example, but it is an organization for LGBTQ youth where it's using sort of chat functions and allowing kids to connect to each other, but it's being monitored by people with an expertise to kind of guide conversations and help signal when young people may need help. And again, this is a population that does unfortunately have some of those higher rates in terms of care. And as we know, may not be able to go to traditional sources, i.e. their parents, for care and help. And now this gives them another outlet where they have access to young people just like them, but to also caring adults who have an expertise and can help them.
Love that. And I would assume that given the rise of AI with ChatGPT and all in the past year and a half, that you're seeing more applications that have some elements of AI factored into them. Is that a fair guess?
We do. I mean, I don't want to say that it's the be all end all, just like with
It's not.
everything else. And I think for us as grant makers, it's really important that the work is directed by people with an expertise in pediatric mental health.
Human
And
centered.
so we're not wholly relying on some other system to be able to do that. But we are seeing more use of AI to help sort of steer people to better information. But I would not ever substitute that expertise for for an algorithm.
Of course not. And I've been teaching courses in AI for social impact, and we all believe that, it's got to be human centered. This can't
Exactly.
be outsourced. Any sort of fun story about how your involvement around this issue has really motivated your employees, has really touched someone that, maybe don't have to name names, but I'm sure you hear from people all the time about how grateful they are for the company standing up for this.
Yeah, I mean, and it's a slight variation, but we simultaneous to doing this, we looked at our internal programs and formed a global well-being board, which does more than mental health, but was really around sort of the health and well-being of our employees. And it's been interesting because we created an influencer network of just interested employees from around the firm. And so many of them signed up to become influencers because they had been following what the Alliance was doing and were incredibly passionate about what we were doing and wanted to kind of figure out a way for themselves to be engaged. So I I'm just really happy. You know, one of the things we didn't know when we launched was whether stigma would play a part in how employees saw it. We didn't know if our own employees had stigma around this. I
Mhm.
mean, I'll share one anecdote from the very beginning that I think informed our work. We were in a session, blue sky, say what you think we should do sessions before we'd agreed to do mental health. And we were going around the table, and there was a businessman who I've known for years, and he was pitching something else, by the way, and that's why this is so important. And then I kind of talked about why I thought we should do mental health. And he quietly put down his pen, pushed his papers across the way, and said, my dad had mental health issues. I spent my whole life sort of whispering about what was going on with him. I'm 100% in on this. I'm in. And everyone else just stopped, put their papers down. And I said, oh, like we've really connected to something when people who had their own agenda dropped it immediately to
And
get
share
behind.
that very
Yeah.
personal
And
story.
this very personal thing. And that's when I was like, okay, I'm not worried about stigma anymore. If that's sort of the first conversation we're having. And that's pretty much the way it's been all along. People being very open about their own experiences, open about what's happened in their families. I hope open conversations at the dinner table between parents and their own children. I've tried. My son mostly doesn't want to listen to it, but but I've tried.
You better listen to this interview. Tell
Exactly.
me, do you have, I mean, in that case, mental health, one, so to speak, I don't mean to make light of it, but for other corporations that are examining their own or considering doing philanthropy, do you have any sort of words of wisdom for how they might be more strategic or go about deciphering what?
Yeah. I mean, I think the old school thing was whatever you do philanthropically has to 100% be about what you do as a business. And that really has not always worked for us. We found that what employees are passionate about isn't necessarily teaching financial literacy, for example. Some people are, but it wasn't everybody. But they were really passionate about kids' health, and it turns out really passionate about kids' mental health. So I think for other companies, don't think about employee engagement as this one lever, which is volunteering or pro bono work. There's a lot of levers, and
Mhm.
employees as users of the information is not a lever you might think of first, but it's become a really critical part of how we think about it. Our employees being educated and then being out in their communities are really powerful tools in the community. They can be incredible advocates for change, for school systems, whatever it is that they're
Sure.
involved in. And that's a big target for us. And of course, an employee who's feeling like their passion is getting fed at work feel more loyal to the place they're working. So it
Absolutely.
is completely self-serving. But that would really be my advice as you think about employee engagement. And I definitely care about employees also volunteering, and we shoot to get at least three-quarters of our employees physically volunteering in addition to all the things I've just described.
Yeah. So what I'm hearing you say is definitely talk to your people, right? If you
Talk
want
to
to
your
build
people.
something, if they're not vested in it, then it's going to fall flat. I saw that when I did
Yeah.
CSR at Christie's. You have to take it to them and let them guide it and build it
You
because
you
they're not.
do, and see how they vote with their feet. Don't just take their sort of word for it. When you're putting out, like I said, the some of the early lunch and learns we did on this as a series, a little bit of a webinar series. When we saw 2,000 employees sign up for our first session, we knew we were kind of onto something. That 2,000 people would take time out of their sort of day to just sit and hear one of our experts talk,
Yeah,
and it's been the same all the way through. And it's different audiences. It's not all the same people, but that's how you kind of know you have a hit is when they actually show
absolutely.
up.
Oh, and the story you told about your colleague when you presented, I love that
Yeah.
story. So one last question. I'm mindful of the time here. Your pearls of wisdom for your own sort of career. What would you say to either your younger self or someone who's maybe a bit older and disrupted and trying to figure out to how to live a purpose-driven career or what?
For my younger self, Lord, you were skinny. I don't know why you never thought you were. No, I think what I would actually say, and I would say this particularly to younger folks, I feel like there's this weird thing now that says if you want to move up, you somehow have to keep moving jobs every 2 years. And it's a fallacy. Might you get a little bit more money here and there? Like you might, but as someone who's been in the same department for 27 years, not the same job, I want to be clear. I've always had new challenges. It's not the same thing every day. But if you love what you do and you love the people you're doing it with and you sort of love the other people around the firm or the culture, don't be stupid. You're going to spend such a huge part of your job being there. You should love it, and it is not worth switching jobs to get $10,000 more. And I'm not trying to be glib about that, because if you're paying for a family, if you've got kids on the dole, if you're trying to support your whole community, I don't want to take away from that. Those are really important. But if you can stay, try to stay and try to be mobile in that seat. Try to figure out where there's opportunities and to keep stretching yourself and to keep coming up with new ideas, because you don't always have to leave to grow. I mean, I joined this firm as an associate and became a managing director in 2011. Like, it happens. You
Yeah.
don't always have to leave to achieve that. And I feel so many people walk away from places they love solely for this idea that that's what you're supposed to do.
Yep, I agree.
It's just, it's, and I'm sure if you talk to other people, like, if you're moving around constantly, you're missing out on all of the networks and the support networks that you get. I mean, I grew up with a lot of the people I still work with. Like, it
Yeah.
doesn't feel like, feels a lot more like family than just coworkers.
Yeah, I'm a sort of a corporate monogamist myself.
Yeah.
I spent 5 years or more in every place I've been, and I'm agreeing with you. And I also think that look for brands with great leadership and the leadership that invests in the people. Right, a lot of the newer brands just don't do that. Like, watch this video, click and play, and that's not
Right.
investing in your people.
And 100%. The other thing that I would say is, there's a lot of companies that talk about giving back or talk about some set of CSR values within their sort of value proposition. Talk to people who work there and find out if it's authentic. I mean, it is here, obviously, I'm saying this, but, I'm through multiple leaders. It has never moved. Sort of the good, the bad, the ugly,
Yep.
our values, our culture is real. Make sure when you're going somewhere, if this is something you're passionate about, talk to people who work there to find out how it really exists.
Yep.
Find out from them, well, when you say that giving back is important, what does the company do about that? And if they can't name a thing, or if they say, oh, I've never volunteered, you might want to check to see, kick those tires a little bit to make sure, because I think it's really important that you can live out your avocation through your vocation. And
Big
when
time.
you work for a large corporation, it should be a booster for your passion in the community. If it's not, it's going to feel frustrating to you that you're not getting to do things you really care about. So if that's something that's important, like, kick those tires, ask those questions. And if
Mhm.
you can, talk to people who actually work there to see if they feel it.
I couldn't agree more. I couldn't agree more. So I want to thank you so much. I know how busy you are. Joan Steinberg's president of the Morgan Stanley Foundation. She's also CEO of the Morgan Stanley Alliance for Children's Mental Health. Check out the website if you want to learn more. It's fantastic work they're doing. And Joan, I hope you'll come back and tell us about the couple of things you have to announce in the near future.
I would love to. Thank you so much for having me.